Walking's often hailed as the golden ticket to health. Doctors swear by it, studies sing its praises, and it feels so simple. Just lace up and go. But here's the twist. For some seniors, that daily stroll isn't the gentle boost it's cracked up to be. It can hurt more than it helps. After years watching how age reshapes us, I've seen it firsthand. What's a lifeline for one can be a landmine for another. Certain health conditions, recovery phases, or hidden risks turn too much walking, or the wrong kind, into a quiet threat. This isn't about fear, it's about tuning in, knowing when to stride and when to pause. Think about it. At 75, your body's not the machine it was at 50. Blood pressure wobbles, joints creak, balance teeters. What powered you then might punish you now. A brisk walk might leave one senior energized, but another dizzy, aching, or teetering on a fall. Too often, we assume walking's a one-size-fits-all fix, harmless, universal. But as we age, everything shifts, and no one's shouting it from the rooftops. The pain you shrug off, the fatigue you ignore, they're whispers from your body, begging for a rethink. I've watched friends push through only to pay later, sore knees, a stumble, a scare. This video's your wake-up call. 5 types of seniors who need to walk less, or differently, right now. We're talking real people, real risks, unstable hearts, worn joints, healing scars, numb feet, mystery exhaustion. If your walks feel off, if new twinges nag, this is for you. It's not about quitting movement, it's about moving smarter. Stick around. By the end, you'll know when to ease up, what to try instead, and how to listen to your body's quiet cues. Health's not a march, it's a dance. Let's adjust the steps. Seniors with unstable blood pressure, walking's risky rhythm. Walking seems like the simplest gift. Fresh air, a steady stride, a heartbeat ticking along. But for seniors with unstable blood pressure, that gift can flip fast. After 70, if your pressure spikes or plummets without warning, a casual stroll might not just tire you, it could topple you. I've seen it. A friend's routine loop left him dazed on a bench, wondering why his legs betrayed him. Unstable blood pressure isn't loud, it's sneaky, and walking can nudge it from quiet quirk to real danger. Here's how it plays out. Your heart's pumping, legs moving, but if blood pressure's off kilter, too high or crashing low, your system strains. A sudden drop, hypotension, dims your vision, spins your head, you're grabbing a wall, dizzy, or worse, kissing the pavement. A spike, hypertension, races your pulse, tightens your chest, stress you don't feel till it hits. Meds like diuretics or beta blockers, common at this age, can amplify the swings. Harold, 79, learned this the hard way. 15 years on the same path, no sweat, until one morning mid-walk, he sank to the curb, faint. A neighbor hauled him home. His doc pinned it on a pressure dip from a new pill. That walk pushed him past safe. The signs? Subtle, lightheadedness you blame on sleep, a blur you blink away. But they're red flags, your body saying, slow down. Walking stresses an unsteady cardiovascular system. Alone, far from help, it's a gamble. Falls follow dizziness, cracked hips, bruised pride, recovery stalled. Harold dodged worse, but not everyone does. You can walk smarter though. Check your pressure first. Know your number before you step out. Stay indoors. Treadmills or malls beat uneven streets. Flat ground's your friend, hills tempt fate. Go with someone. Company's a lifeline if you wobble. Harold's new drill? Morning readings, shorter loops, a buddy tagging along. Steady now, not shaken. Chat with your doctor. Med tweaks or indoor swaps might fit. It's not weakness, it's wisdom, moving with your body, not against it. After 70, unstable pressure doesn't bar walking. It just rewrites the rules. Step light, stay safe, your heart's worth it. Seniors with advanced joint degeneration, when walking wears you down, Walking's billed as the golden cure. Keep moving, stay young. But for seniors with advanced joint degeneration, every step can grind deeper into trouble. Knees, hips, lower back. When cartilage thins to whispers and bones rub raw, long walks or hard surfaces don't heal, they harm. I've seen it. Martha, 82, limping home after her proud 3-mile treks, icing knees that screamed louder each night. After 70, severe osteoarthritis or worn joints turn that healthy habit into a painful paradox. More damage, less gain. Here's the mechanics. Cartilage doesn't regrow much with age. Advanced degeneration, bone-on-bone contact, means every stride sparks inflammation, swelling, stiffness. Hard pavement or long hauls amplify it. Nerves flare, joints groan. You might feel it mid-walk, grinding, locking a burn, or later when stiffness locks you in bed. Falls lurk too. Pain skews balance, legs buckle. Martha thought pushing through was grit. Her x-rays begged to differ, severe where no cushion left. Her daily badge of honor was chiseling her joints away. Too many shrug it off, just aging, or guilt-trip themselves for resting. But this isn't about quitting, it's about shifting. Movement matters, but not all kinds fit worn joints. Long walks on concrete? A wrecking ball. Hours upright? Swellings invite. Martha's wake-up call came when her doc laid it out. Keep grinding, lose more. She pivoted, shorter strolls on soft tracks, water aerobics, supportive shoes. Pain eased, sleep returned, smiles too. She didn't stop, she smartened up. You can too. Cut the distance, 10 minutes, not 30, rest between. Swap for low impact. Cycling spins wheels, not knees. Swimming floats you free. Shoes matter. Cushioned, joint-friendly pairs cradle wear. I've watched clients trade hobbling for humming with these tweaks. Less ache, more life. If walking's a chore, hours of soreness, creaks you can't ignore, it's your joints waving SS. No shame in easing up, it's care, not surrender. After 70, advanced degeneration doesn't ban motion, it demands finesse. Listen, adjust, try a pool, a bike, a softer step. Your joints have carried you far, now carry them back, gently. Seniors recovering from recent surgery. Walking too soon risks healing. Surgery's a milestone. Spine fused, knee replaced, abdomen stitched, and the itch to walk again hits fast. After 70, that urge to reclaim your stride feels like hope, proof you're bouncing back. But here's the hitch. Too much, too soon can unravel what's mending. Tissues knitting, muscles relearning. Push them with early walks, and you're not speeding up, you're stalling. I've seen it. Frank, 74, hobbling post-back surgery, thinking steps meant strength. Weeks later, he was worse. Pain sharper, recovery stretched. After surgery, walking's not a race, it's a weight. Your body's raw after the knife. Spine ups shift balance, knee fixes need stability, abdominal cuts guard core strength. Walking early hammers healing zones, ligament strain, inflammation flares, nerves protest. What feels like a gentle shuffle to you might jolt fragile repairs. Frank's tale proves it. Post-op, he hit the pavement days later, proud of his grit. By week 2, leg pain shot down, wobbly steps betrayed him, muscles overstretched before they meshed. His doc sighed. Months added to rehab, all avoidable. Rushing risks complications, stitches pull, joints falter, hospital doors swing back open. The trap? Thinking motions always progress. Rest's the real hero here. Time lets scars toughen, strength rebuild. Docs don't bench you to bore you, they're guarding gains. Frank ignored, take it easy, paid steep. Too many seniors misread stiffness as a dare, not a plea for patience. Healing's not linear, push, and weak spots crack. You can move right though. Rest first, days, weeks, as ordered. Physical therapy's your map, guided stretches, not guesswork strolls. Start small, chair rises, hallway shuffles, when your team says go. Build slow, 5 minutes today, 10 tomorrow, tracking breath, steadiness. Frank's redo? Therapy-led, gradual, pain faded, legs held. I've watched clients thrive pacing it, surgery's a storm, you don't dance in the rain. After 70, recovery's fragile, walking's gold, but timed right. Ask your crew what's safe, lean on their plan. It's not stalling, it's stacking odds for a full comeback. Step less now, stand tall later, your body's worth the wait. Seniors with peripheral neuropathy, walking on shaky ground. Walking's second nature, until it isn't. For seniors with peripheral neuropathy, that steady stride turns shaky, a quiet betrayal of nerves misfiring in feet and legs. After 70, this nerve damage, often from diabetes or age, steals sensation, numbness, tingling, a sock bunched up feel when it's bare. I've seen it, Susan, 70, stumbling on her sunset strolls, confidence rattled. Neuropathy doesn't just tweak comfort, it tips balance, courts falls, and makes every step a gamble. Walking less, or smarter, becomes a must. Here's why. Your feet stop talking to your brain. No feedback on pressure or pain means curbs blur, cracks hide, terrain's a trap. Toes drag, steps waver, reflexes, already slower with age, can't catch up. A pebble unnoticed cuts deep. A stumble twists ankles or worse, fractures that chain you to a chair. Susan's wake up? 2 near falls in a week. No big crash, but enough to spook her. Her doc confirmed neuropathy, uneven paths were now foes. Falls aren't rare here, studies peg them high when nerves fade, balance frays. You might adjust, stare at your feet, shorten strides, but that tires you fast, body and mind. Pushing through's no fix, risk climbs. Susan loved her walks, didn't want to quit. Too many think numbness is just life. It's not, it's a signal. Ignoring it courts bigger spills, not grit. There's a safer way. Stay indoors, gyms, flat floors ditch the wild cards. A cane's no defeat, it's a steady hand, Susan swore by hers. Strengthen ankles, simple lifts, seated twists rebuild what's weak. Shoes matter, wide, supportive pairs hug numb feet, cut sway. She swapped trails for a treadmill, added exercises, stumbles stopped, walk stayed. I've watched clients shift, less distance, more control, fear gone. After 70, neuropathy doesn't ban motion, it begs caution. If feet buzz or blank out, don't shrug, adapt. Walk with a partner, ease the pace. Your legs aren't failing, they're asking for backup. Step indoors, lean on tools, move free, not frail. Susan's sunset's now a gym glow. Safe, sure, still hers. Seniors with unexplained fatigue or shortness of breath. When walking drains you, walking's a breeze, until it's not. For some seniors after 70, a short stroll sparks fatigue that lingers or breath that cuts short, a heaviness you can't shake. It's not just getting old, it's your body whispering trouble. Heart hiccups, lung strain, or silent anemia might lurk beneath, pushing through risks more than a bad day. I've seen it, George, 81, park laps shrinking, benches calling. Unexplained exhaustion or gasping isn't laziness, it's a plea to pause, not plod. Here's the why. Your ticker might falter, heart failure or atrial fibrillation saps stamina, tightens your chest mid-step. Lungs, scarred by COPD, wheeze early, oxygen lags. Anemia sneaks in, low red cells starve muscles, legs turn lead. These don't blare in a checkup, they creep out when you move. George brushed it off, age, he figured, till he couldn't finish his loop. Halfway winded, he sat, then quit. Too many chalk it up to off days. But when breath shortens fast, pulse races, or fatigue sticks, it's no fluke. Walking's a stress test, your system's flagging. Ignoring it's dicey, heart strain grows, lungs weaken, falls loom if you fade mid-stride. George's doc dug deeper, valve disease, treatable, caught late. Pushing past didn't toughen him, it taxed him. Symptoms like these don't shout. They simmer, easy to miss till they're loud. You can pivot. Rest's your reset. Skip walks when you're wiped. Sit, breathe. See a doctor, tests, EKGs, blood counts, unmask culprits. Ease up, 5 minutes, not 15. Flat paths, not hills. Track it, tight chest, quick gasps. Note, report. George's fix? Meds, diet tweaks, slow lapse, he's back steady. I've watched clients shift. Less grind, more grace. Energy returns when you listen. After 70, this isn't weakness, it's a crossroads. Walking's gold, but not if it guts you. Rest isn't retreat, it's recon, check what's brewing. Swap stubborn for smart. Your heart, lungs, blood deserve it. George's parks is again, gentler, wiser. If fatigue or breath steal your stride, don't shrug, probe, pace, heal. Steps should